Hi, I'm Dr. Jay Harness from Breast Cancer Answers. With my patients who are on tamoxifen, I'm often asked the question, hey, Dr. Harness, are there any supplements I can or cannot take while I'm on my tamoxifen therapy? Well, before I answer that question, let me take this opportunity to first thank our sponsor, Breast Cancer Index. It's a test that may help women with estrogen receptor positive early-stage breast cancer to decide with their doctor whether to extend or end anti-hormonal therapy after 5 years. One of the really interesting things about supplements and alternative and complementary therapies is it has been estimated that greater than 50% of all cancer patients, including breast cancer patients, are taking some sort of supplements, herbs, vitamins, doing complementary and alternative things. Now, specifically, let's talk about tamoxifen. As far as vitamins and those kind of supplements go, I'm not aware of any that you should or should not be taking. However, the one thing you should not be taking if you're on tamoxifen is, of course, estrogen. Now, the amount of estrogen that you would find in soy is not harmful, and frankly, you probably have to take in a wheelbarrow full a day to do any sort of harm or counteract the tamoxifen, and nobody's going to be doing that. But one of the real debates then is about estrogen suppositories for vaginal health. This debate goes on and on. The strictest of medical oncologists say, no vaginal estrogen at all because it's going to be reabsorbed by the body and tend to counteract the effect of the tamoxifen, or for that matter, an aromatase inhibitor in postmenopausal women. On the other hand, what happens to the lining of the vagina when they're estrogen deprived is that lining tends to thin out and then obviously cause pain with intercourse and things of that sort. One of the theories is that if you begin introducing estrogen back to the vaginal lining, it'll thicken up, and once it does that, then very little estrogen is absorbed after it re-thickens up. I would strongly recommend that you deal with your medical oncologist concerning the issue of vaginal estrogen to help with the health of the vagina and to make intercourse more pleasant and to have a robust sexual life with your partner. As far as other supplements go, I know of no other that are contraindicated if you're on tamoxifen or an aromatase inhibitor, but please always work with your medical oncologist or your breast surgeon with questions like this. Hopefully you have found this summary helpful, and so I'd like to take this opportunity to thank our sponsor, Breast Cancer Index. To find out more about treatment options beyond year 5, just click the button and download our free list of 15 questions to go through with your physician.